Before the mid-19th century, surgery was synonymous with unbearable pain, rapid procedures, and a constant struggle between life and death. Without effective methods to dull sensation, patients faced operations fully conscious, while surgeons developed techniques focused on speed rather than precision. The introduction of surgical anesthesia, first through ether in 1846, transformed both medicine and humanity's relationship with pain. This paper explores the historical trajectory of anesthesia, from ancient attempts at pain relief using herbs and alcohol to the revolutionary discovery of inhaled anesthetics and the profound social and medical transformations that followed. 1. Introduction. The age of pain until the 1840s, surgery was an ordeal few survived without trauma. Pain was considered inseparable from the healing process, and both patient and physician accepted it as inevitable. One of the most vivid accounts is that of Frances Burney, an English novelist who underwent a mastectomy in 1811 without anesthesia. Her personal writings describe the experience as so excruciating an agony that words could not contain it. Surgeons, faced with conscious and screaming patients, prioritized speed above all else. Famous 19th-century surgeon Robert Liston could amputate a leg in under 30 seconds, an impressive feat, but one that reflected necessity rather than cruelty. The surgical theater of the early 1800s was a stage of horror, blood, screams, and restraint. The inability to control pain was one of medicine's greatest failures. 2. Ancient roots of pain relief. The search for pain relief long predates modern science. Across ancient civilizations, healers experimented with natural substances that offered sedation or euphoria. Sumerians, circa 4000 BC, used the opium poppy, calling it the joy plant, to dull pain. Ancient Egyptians and Greeks mixed alcohol with herbs such as mandrake and henbane. Chinese physician Hua Tuo, 2nd century CE, reportedly developed an herbal anesthetic known as mefizin, a blend of wine and medicinal plants used during abdominal surgeries. Islamic scholars, notably Avicenna, Ibn Sina, in the 11th century, described soporific sponges soaked with wine and narcotic herbs to be inhaled before surgery. These early innovations, though primitive, reveal a continuous human desire to separate healing from suffering. 3. The pre-anesthesia era. Surgery as endurance. Despite centuries of experimentation, pre-modern medicine never achieved complete insensibility. Sedatives dulled the senses, but could not block pain. Patients relied on alcohol, opium, or simple physical restraint. In battlefield amputations, several men held the patient down while the surgeon worked at full speed.